we can move through some items on the agenda. I just wanted to double check as well in terms of, I don't see any members of the public here, unless I'm missing anything. I don't think so. No?
No.
No, okay, that's fine. I'll just go through welcomes because I see you there, Lindsay, with your hand up. So I've got you down, Lindsay. So I'll deal with apologies and I'll tell everybody about yourself. There you are. I can see you at the bottom of my screen. Hello. So just in terms of apologies that we've got John Whitehouse and Deb Lee. Both, well, actually, Deb's not so well, and John's actually on holiday. And I'll touch on Deb at the very end of the meeting, because it's actually her last meeting was the one before this, because she was expecting to be here today. But I'll touch on that at the end. We have apologies from Health Watch from David Blacklock and Lindsay. You're here and you're most welcome on David's behalf. So it's nice to see you. Have you been to one of our meetings before, Lindsay?
I haven't.
Okay, well, just so you know how we run them, it's a meeting in the virtual public world, as it were. So it is a public meeting for the part one. Then at the part two, normally the sort of representatives like yourself will leave whilst we just do some sort of confidential business. So as long as you're aware of that, if that was okay. I don't know if David told you that.
Yeah, I did want to check the part two, so I leave after part one. That's fine. Yes, thank you.
Right. Yeah, okay. Thanks so much, Lindsay.
Thanks, John.
It's okay. And then I think I did have. I thought Ross McDuff was going to come from the LMC, but I can't see Ross on here, unless anybody else can. No. Okay. And I think just for the time.
I can't see Helen or Gareth either. Have we? Does anyone know if they're joining?
Gareth's on is off at the moment, Brenda. He's on sick leave, so he would have sent apologies. Helen definitely has it in her diary, so
Helen and I have just finished a meeting. She'll be with us very shortly.
There you go.
I wonder if she's having the same reboot problem. So we're expecting, we've got Mark here, that's good. So we're expecting Peter, Charles and Helen. And on the basis of that, here's Peter. We knew about your problems, Peter, so we're just literally going through.
Thank you.
Welcome and apologies. So and I know we're expecting Charles as well shortly. Okay, so I think that covers everybody in terms of members. Brenda, I do believe, for everybody. Okay, declarations of interest. Just in terms of anything on there that anybody wants to declare, I don't think there will be. I suppose the only one is probably down to me in terms of item 8 as Integrated Care Board Constitution, because I'll be a member of the board. But as long as people are happy that it's not a major decision that we're going to make today, I was going to just carry on and lead us through that as well. You know, and of course, Mark's in the same position as I am, in effect, within that. So we'll note that, but we'll also say I don't think that causes any problems whatsoever unless colleagues disagree. No, I think that's okay. Okay. All right, then just moving on to the minutes and the action log for item 3. Minutes held on the 17th of March. Is there anything on there where people just want to check for accuracy? And I'll really quickly go through page by page. Page 1, 2, 3, 4, 5, 6, 7, 8. Are we happy with that? Yeah, okay, we'll sign those as a true record. There's no specific actions that came out of the meeting, but I just wanted to sort of check in terms of, is there anything matters arising wise from those minutes that's not going to be covered on the agenda that anybody just wants to pick up? No? Okay, happy with that. I'm just going to shift a couple of items around and I'll tell you the reasons why. I know that Julie and Ed have to go at 2 o'clock for an important phone call with an MP. So what I was going to do, chair and accountable officer report, and then just to make it more painful for you, Kate, I was just going to ask Julie to do her report for the engagement and communication. Are you okay with that, Kate, or have you got a specific timescale you're working to? You're okay. Okay, that's fine. Right. So I was going to introduce Mark for the chair and the accountable officer report, and over to you, Mark.
Thanks, John. Hello, everybody. Good to see you all again. So you've all had the report. Just a couple of items that I want to highlight, if I may. I think everybody should be aware now in terms of the ICB that Health and Care Act received its royal assent at the end of April. So everything is in place to start with the ICB on the 1st of July. The clear focus on the ICB is now to put everything in place to get it to a point where it is able to take over the responsibilities of the CCG. And as you can imagine, there is a huge amount of work going on around that, not least the fact that there are 2 consultations going on at the moment, a phase 2 consultation with those staff affected at board level, governing body level in the CCGs, but also a global cross CCG TUPE-like consultation going on with all staff in the CCGs, with the aim of getting everybody who is employed on the 30th of June in the CCGs into the new ICB organisation on the 1st of July. In terms of other areas, then there is an Nhs Staff Survey going on. And the results show that our staff have rated the organisation being at or above the national average in terms of many of the key measures, which I think is a really good place to be in. We had a very good response from staff, 86%, and has scored above average for a number of different areas, including team working, support of line management, compassionate leadership. There were some areas to improve, and colleagues can see that in the document, being safe and healthy, flexible working and work pressures. And of course, we are considering those and putting in actions in order to take those things forward in the organisation. Pressures across the system continue, and I think that's very well understood and documented. Particularly challenges across primary care, community and acute for ourselves in North Cumbria. There are challenges in the other parts of the ICB, but again, we still do deal with lots of very Cumbria specific challenges for us in this area. As we approach the Queen's Jubilee Bank Holiday, NHS is encouraging people to choose services wisely, make sure they don't run out of essential prescriptions, etc. And as you can imagine, all of the work is going on to make sure that we have very robust services in place for our public patients over that period of time. Local government reorganisation, as I'm sure people are aware, elections took place on May the 5th for the 2 new unitary councils that will replace the 7 local authorities. John Metcalfe has been appointed as the new interim chief executive for Cumbria County Council, and we welcome Charles to the area on that behalf. In terms of the Let's Talk Bereavement project, is training people in North Cumbria to support those going through bereavement, and is funded by NHS charities. I think useful to note that money raised by Captain Sir Tom Moore during lockdown. The project sits with CLIC, and the first wave of training aims to increase understanding of grief and provide tools and resources for people. Later in the day, we hope to expand that in terms of specialised skills training. I think the last point is in respect of locking the lakes, and John, I'm going to pass to you for that.
Yeah, thanks, Mark. I just wanted to say in front of colleagues here on the governing body, a big thank you to Suzanne, really, and her team, and the wider partnership as well, who supported that. But it was led by CLIC, and what a wonderful event it was. I mean, upwards of 160 people there on Tuesday. Some people around this screen today, talking about health inequalities and just some fantastic talks. We had Colin Cox and Michael Marmer as a bit of a double act, which I thought was really, really good, actually, and very powerful. And again, you get the national flavour and a really influential figure like Michael Marmer, and then you get Colin trying to frame that within a local context as well. And it's not going to be easy, is what I would say. It's not going to be easy. And then just Sam came along, Sam Allen, and I just, as I said to Sam personally afterwards, thank you so much for coming, to embrace us and for Suzanne to get Sam to come to North Cumbria. I think it's really positive for us and sort of represents us as an area. And I know she went away from the meeting really enthused about the approach and the learning that was taking place across a partnership. Just some fantastic stuff, but I think what it set up for us was more questions and challenges than it did solutions. And I think as we go through the turmoil, literally, of everything that's happening internationally and nationally, and we go through our own internal restructure and the council going through their restructure, it's not going to be an easy way through to make sure we can try and keep this on the agenda, because if we're not careful, we will fall back to just doing the things we need to do to keep the lid on things. So I say that as a context. I don't want to say any more than that, Mark, about it. But again, just a big thank you to you, Suzanne. And I think that probably, I'm just going to open it out to questions then, really, Mark, on the report itself, if you're okay with that. Yeah.
Yeah, John, there is just before you open it out to questions, thank you for the update on the lock in the lakes. I just wanted to say, though, as a finish off to this item, you know, the role of the lay members will end with the organisation, and we are cycling towards that point, you know, really quite quickly now. And I think that we just wanted to put on record our thanks and gratitude and respect for all of our lay members, and the contribution that they have made to the organisation, and the contribution that they have made to the workings of the organisation and the decision making that we've done as we've worked through the years, and indeed everything that then reflects in terms of what we've been able to do for our public and patients. So, you know, a massive thank you to all of our lay members for everything that you've done. It is very much appreciated by everybody.
Thanks for that, Mark. On behalf of the lay members that are here, Denise and Carl, I have to say, yeah, really much appreciated. Really much appreciated. I'll make sure the message gets passed to Deb and to John, who obviously can't be here today. Okay, I've got some hands up. Carol.
Thanks, John, and thank you very much, Mark, for that. Really is appreciated. And I think I can say on behalf, at least, of the rest of the lay members, we will really, really miss everybody, you know, because it's not just been a job, it's been, you know, a part of our lives. So I'm actually filling up now. It's ridiculous, but we really, really will miss you. And it's been an absolute pleasure and a privilege to work with such an excellent team in North Cumbria. I've worked in the NHS for 20 odd years, and I would say it's the best team that I've ever worked with in terms of competency, compassion, and just sheer amazing skill and ability. So thank you. Anyway, that wasn't what I was going to say. I was going to talk about locking the lakes. I just wanted to add to what John said. It was an amazing event, Suzanne. You and your team must be immensely proud. What I particularly loved was the huge amount of partnership that was displayed in the event. We had lots of third sector organisations not just taking part but leading sessions and giving us a real flavour about the complexity and the interconnectedness of North Cumbria. We had the local authority there leading sessions. It was really fantastic. And if anything, you possibly couldn't tell that it was an NHS-led event because it was such a huge partnership effort. And I really enjoyed the day, not just because it was a fabulous event, but also we got to see people in person. And like Ed and I, we managed to meet, and I had not met you, Suzanne, until Tuesday either, had I? So that was great. And also, I think you are right, John. There are more questions than answers. You know, Michael Marmot's stark public health context in terms of life expectancy is shocking in terms of the reduction in the increase in life expectancy since 2010. And in fact, in our poorer communities, you know, nationally, I'm not talking about Cumbria now, some areas are seeing a reduction in life expectancy. I think we really need to understand that context in Cumbria. I think we probably already do, but I would like to see that information in that context to be clear for the population of Cumbria. What exactly are we saying for the most affluent and the least affluent people in Cumbria, and what are the trends there in terms of our life expectancy? And the fact that, you know, he could put stark evidence to demonstrate that, you know, poorer communities are getting poorer, and by consequence richer are getting richer. So I think we do need to understand, if that's the way things are going nationally, from a public health and an NHS perspective, what can we do locally and regionally? Because that was the challenge. What can we do locally and regionally to start to address that balance and work on these issues? So I'm not attempting to be political, but I do think there were some really stark issues that came out of the conference to me on Tuesday that I think that I'm hoping at place going forward when we're no longer here, that these conversations will continue. Thank you.
Okay, thanks for that, Carol. Anything else from anybody before we move on? One thing I did want to say as well is we have got another meeting of the governing body as well in June, so you get to say that all again, Mark. We will really appreciate it. Just the final one for me, just on the local government reorganisation, just to add to what Mark said. There is now sort of the forming of the two unitary authorities, and I think it's probably 2 days ago now, yeah, 17th. There was the selection and approval of the two sort of leaders and their cabinet, as it were, of elected members that took place for both the Furness and Westmoreland and the Cumberland. And you don't need to know, I'm telling you stuff you know, but obviously with the Eden sort of Furness area, that's Liberal Democrat with a clear majority, and then the other for Cumberland, that's Labour with a clear majority. So they've got their shadow cabinet members and leadership in place for the councillors. There's still work to do on their chief executives. They have they call it a different thing at the moment in terms of the shadow, which is like a head of paid service, which is nominally the interim chief executive, but everybody who is doing a chief executive role and all those councils that are still in place are still the ones that carry the responsibility up until the 1st of April. So it's going to be interesting in terms of how we can interact with the council and the new farming councils as they get created. But it's the 1st of April when the formal change takes place. Okay, happy to move on. Thank you. I'm going to then, I did say I was going to bring yourself in, Julie, so you and Ed can get your time away, or at least we say have the time to get away and not have the worry of speaking. But you're going to do what is item 10, communications engagement and your co-production, I presume, annual update report. Yeah.
I did, and thank you very much for flexing the agenda around, and thank you to Kate for hanging on a little bit longer. I won't go into too much detail because there's lots of information in there for you to read, and I know that the governing bodies previously had a more detailed report on the health inequality work around the vaccine programme, which has been a big part of what the team's done over the last year. We divided it into work around keeping people informed, keeping people involved, and keeping people safe, kind of following on from how we described it last year. They were a good way of chunking up the work that we do across the team. You will notice that the keeping people informed, we put all of our statutory stuff in there, the FOIs, the MP letters, responding to inquiries, media inquiries, proactive media work. It hasn't got any quieter. In fact, it's getting even busier all the time in terms of freedom of information requests, as I know many of the people on the call will know, because they're on the sharp end of responding and answering to them. So that's a big chunk of our work. The involvement stuff's the reason I get out of bed in the morning, getting people involved in NHS services. And you know, just add to what everyone said about Locking the Lakes and the work that Click's done. Click is just a little machine of involving people, focusing on co-production, really highlighting some of that improvement work, and improvement work should always have people at its heart. It's still a mystery to me, and I don't think it happens amongst us, but you know, when you get people saying they're going to change services but don't involve patients or their staff in it, it's just, you know, we've moved on from that. We're in a different place now, and we should acknowledge when we have events like LOC that most of the workshops that were presented were people that work with the CCG, in the CCG, through the CCG, on specific bits of projects which are involving people and making things better for patients and for service users and for staff. So all of that is all very, very much linked in. And the keeping people safe, as I said, it's mainly been around the vaccine programme, not so much stay at home, don't go out. We've moved on from there because of vaccine. And I think, you know, I'm certainly glad I had my 3 jabs before I had COVID. It would have been much more horrible, I think, without it. And actually, it was horrible enough as it was. So how far we've come in 2 years since comms was the main first stand against COVID, was keeping people informed, telling them what was safe and what wasn't safe. That was the thing that was saving lives. And now we're much further down that road. The only other things that I wanted to reflect on were kind of changes in the team. So currently we've got Abby a couple of days a week from Nhs, who's bringing a lot of influence and experience from the other CCGs across the North East, which has been great. We've got Heather, who's kind of the first line against inquiries and is kind of responding to some of the statutory stuff that we have. And we've had some support from Lynn Hardy as well. And that's all been because we lost Kieran. So I just wanted to say, really formally over the last, I think 2014 he joined the CCG. Kieran has been a real key part of what we do, not just in the way that he's supported other teams, but you know, he's handled so much. He's been the front door to the CCG for a lot of people, and we desperately miss him. But I'm delighted that he's gone on to a promoted role in Health Education England, and he's being stretched in different ways. The only other thing that I was going to mention was the relationship with the North East. Obviously, it's going to be massively important as we become the North East and North Cumbria Integrated Care Board. We have a really strong relationship across the comms network. We all say the same thing at the same times, and it's usually around using our services wisely because we're all under pressure. In terms of engagement, it's been a slightly different story. So as we know, relationships are always held at a local level, and apologies if you've heard me with my cowboy story before. If you think of cowboys, you think of John Wayne and you think of Clint Eastwood, but they were never in a film together. And it's been a bit like that for the engagement leads. We've all worked in expertise in the areas that we do it, but we've not really had reason to work together because of those local relationships around local services. So I've been really fortunate to lead a piece of work trying to connect some of our engagement leads, which has been on a personal level very rewarding, bringing that group together. Loads of expertise across the system. We're developing our strategy for the ICB, which will be iterative. Once we get it signed off, it will not be set in stone. It will be constantly developing, but there's a real desire within that to have much more use of lived experience, to be innovative where we can, and to really value the existing relationships that we have. So it's absolutely not going to be close the door on the 30th of June, open it up on the 1st of July and do it all differently. It will continue with the people that we've worked with and some of those community leaders across North Cumbria that have been really challenging to us, but also really supportive in the work that we've done. And my own personal reflection is, I think the last few months I've probably spent more time on primary care than any other area. So it's always a bit of a canary in the mine, isn't it? It kind of shows you where the problems are going to be coming. So I'm just flagging that up. Ed knows that all too well, I'm afraid. We also have some positive stuff coming out around primary care. We're doing a lot of work at the moment around recruitment to try and attract people to come and train here, people to come and join the fellowship programme here, and people coming to relocate and to work in North Cumbria. And that's talking to GPs that are doing it and telling their stories and about what they've liked. And it's really nice because they've all said the same thing without us prompting them, which has been that support and that teamwork and the real variety of work that you get in North Cumbria, and loads of opportunity to develop, which I think is the key thing we need to let people know. If they want to come and work in North Cumbria, they're going to get a real range of opportunity to do things differently. And then more community focused, and this will be later in the year, and hopefully Paul will be leading on this, but we'll be sharing much more information about some of the new roles that we have in our primary care teams and about why you might be redirected to social prescribers or to frailty care coordinators or first contact physios, and the benefits. So it's not because your GP can't see you, it's because actually they might be better for you and help you more roundly. And again, lots of really lovely feedback from those people working on the ground, and it's been about working with people and working in teams that are really supportive. So lots to shout about North Cumbria, and I think that'll be of great benefit to the wider Integrated Care Board when we get to that point, to be able to really showcase some of the work that's going on here. So I said I wasn't going to say much, and then I've talked for 15 minutes, so I do apologise.
Well, thank you, Julie, as always. Questions, comments? Denise, go ahead.
Yeah, I just want to commend Julie and the team, really. It's such a small team, but I think we're hugely privileged in North East North Cumbria with in North Cumbria with Julie's team, but also across the North East with the work that she's done to help as we go to a wider system. I think if we just look at the amount of work on keeping people informed, I think I was shocked last year by it, but we're talking about over 6 requests a week, so over 1 a day, which is just a phenomenal amount of time. But then that pales into significance with the sheer time involved in keeping people involved, because I know Julie talks about lots of the meetings. It's not just going to those meetings, it's the tens and hundreds of hours that she personally and the team put in to making those meetings actually happen well, and then all the talking around them, the conversations that she has with our stakeholders, our Volcom sector, etc., to keep them involved. She really does put a huge amount of effort and time, very often in evenings and weekends as well. In terms of keeping people safe, I think the whole success of our vaccination programme has been applauded many times, but the a huge amount of the credit to that clearly goes to the people delivering it, but also goes to Julie's team to get people into those vaccination centres, particularly the work that they've done with the Seldom Heard. It's been really innovative, delivering at Appleby Fair and all sorts of other events that have happened, which I think are really, really commendable. And then I think lastly, just the coming sixth in the CCG ratings. You know, I know a little bit about the work that Paul put in towards all the browse aloud, etc. And then it's changed name now. What's it called? Reach Direct. But again, we've got to be accessible, and we are through the work that's gone on there. I think we all have to recognise how small the team are. And I know it is said on occasions that there are other CCGs that don't have the sort of a team, but we benefit in our area, certainly with our health inequalities. And so, yeah, just a huge thank you. Relatively short report that just, you know, sort of does credit, but not to the vast amount of work that goes behind it.
Thank you, Denise. That's really kind. I'll feed that back to the team as well, because it's definitely a big team effort. And also, I need to flag up while we've got Lindsay on the call as well, the work of the community forums and the work that Healthwatch does supporting those conversations is really important. And Lindsay's going to play a key role in making sure that that keeps happening. So we've got to keep Lindsay on side. But thank you, Denise. I'll feed that back to Paul and also to Kieran as well, and Heather and Ruth and Abby.
Okay, thanks, Denise. Mark, and then I've got Suzanne.
So I think Denise has just said very many of the things I was going to say, actually. You know, without reiterating it all, thank you, Julie, and the team for everything that you've done putting this together, but also all of the work that you do facilitating all of this work during the year. You know, it is fantastic. I do reflect on the way that we work with partners, but very specifically our public and patients in terms of much that we do. And Denise is right, it is recognised in lots of different ways and by lots of different people. And we did put into the chairs and accountable officers report, you know, Richard Barker's visit, where Richard very clearly acknowledged the passion for patient care, innovation, and also the role of volunteers and the public in terms of the delivery. And I think that's really, really important. And of course, you know, we have gone out to those areas and thanked the public specifically on that. But it is a real credit, I think, to the way that we work in North Cumbria and everything that we've done, how we involve and how our public and patients and our communities involve themselves in our work, and it allows us to be very successful in those areas such as vaccination. But again, thank you to the team for everything that you're doing. Is much appreciated.
Thank you, Mark.
Cheers, Mark. Suzanne?
Yeah, I just wanted to reflect back the recognition that Sam gave at the opening of Lock in the Lakes around the work that Julie did nationally around co-production. The fact that Sam had heard of Julie before she even heard of the North East and North Cumbria. So I just wanted that recorded.
Fair point. Yeah, and I was there. That definitely happened. In fact, I was next to Julie when she said it. Okay.
Thank you, Suzanne. I'm quite annoying to the national team as well as to the local CCG team. It has its uses.
So we just asked to note the report. Is everybody comfortable with that? Yeah. Okay. Thank you so much again for that, Julie. Just wanted to go back to where we were then, and Julie, you and Ed step out whenever you feel the time's right, and obviously come back whenever you feel you've finished. And just going to pass on now to Kate for the annual report on the North Cumbria CCG Learning Disability Mortality Reviews. So over to you, Kate. Thank you.
Okay, I'm just going to share my screen because I've just got a very short presentation, if that's okay.
Yeah. It's come up. It just needs to go into.
Yeah, I know I've just had an email that's just dropped in, so I just need to go on to slideshow. Sorry.
Okay.
That's really annoying, isn't it?
Yeah. Well, you've had everything teed up, ready to go.
I know I did, and I've been practicing as well. So there you go.
It looks perfect, Kate.
Okay, so I'm here today to talk to you just briefly about the Leader annual report, and I'm here on behalf of Nikki because Nikki's on annual leave today. So I'm sure that you'll be aware that Leader is learning from the lives and deaths of people with a learning disability and autism. In previous years, the focus was purely on the death rather than on the life. So anyone aged 4 and over with a learning disability, and as of February this year, anyone with a diagnosis of autism aged 18 or over are reviewed. So this is our 4th annual report. It's a requirement of the Nhs Long-Term Plan, and the report includes a summary of the work undertaken during the last year. So leaders' long-term aims are to reduce inequalities, prevent early and avoidable death, and also make improvements for this vulnerable client group. And very sadly, on average, people with a learning disability die 20 to 30 years younger than the general population. So I know, Suzanne, you mentioned at the Lock in the Lakes that on average, where you lived in the Eden Valley, you would live until you're 83. So that's just put it into perspective. So I'm 53. So if I had a learning disability, the chances are I could die now. So this is the second year that we co-produced the report with our Confirm and Challenge group from our local advocacy group at People First. Users and carers will very much enjoy being involved and offer a really useful insight and a unique perspective. We've had a lot from help from Paul in comms to make it more visual and accessible and hopefully more easy to read. And we're still going to produce an easy read version format with our group of people from People First as well. We would like to thank families for their input and acknowledge all of the hard work from our reviewers, clinical staff and providers and everyone involved in our service improvements this year. Like last year, we've improved some pen portraits of the actual people who have died. Their names have been changed, and this is to emphasise that the report isn't just about numbers, but about real people who have loved and lost. You will see this year that very sadly there's been more deaths of people who are younger, so this makes it even more sad and even more important about the learning. So we've had a smaller number than last year due to the closing of the Bristol platform. You may remember Nikki informing you last year the need to front end some work in the previous year to avoid a backlog. It does make the sample size too small to make a meaningful generalisations. So this year, autism deaths have been included, and currently we're reviewing 2 deaths of people with autism. So far as we're aware, North Cumbria are the only CCGs across the northeastern Yorkshire who have got 2 reviews of people with autism. These reviews are very challenging as reviewers are familiar with learning disability aspects, but not those of people without a learning disability. Supervision sessions have been offered to reviewers by Dr. Mandy Boardman, and the themes so far are of late diagnosis, lack of supportive services, and lack of reasonable adjustments for people with autism. There's an increase in the number of younger people who've died this year. It is surprising, but no common reasons have been found. They were varied and causes are in line with the national picture of pneumonias and pulmonary embolism, etc. 6 of the 14 completed reviews were of people aged 55 and under. It could be speculated that the impact of COVID has meant that some people have accessed health services late, but again, we can't be sure. We have had high ages for the last number of years, so this could just be a statistical variation. So looking at the themes, they seem to be the same across previous years, but thankfully are getting much less. There's a lack of hospital passport, reasonable adjustments given to people, and a reduction in the amount of annual health checks carried out. This reduction in part we're thinking is due to the most recent COVID wave, which has resulted in staffing pressures in general practice, where staff in primary care were diverted to support with the vaccination programme. We had many achievements this year, and we'd like to take the opportunity to highlight the co-production of a new health action plan. A multi-partner task and finish group was established to review the national Nhs template. Suggestions were made on ways it could be modified. This work was co-produced with our local learning disability advocacy group, as well as with a group of young people and their families and carers. This work has been shared across the ICS and also has been shared nationally. A new system-wide governance sign-off panel has also been formed to make certain that reviews are of high standard and to ensure that any identified learning is translated into smart actions and where recommendations are made and also shared with our system partners. So thank you. I'm happy to take any questions.
Thanks, Kate. And thanks for the report and the presentation as well. Very clear. I'm going to go to yourself first, Mandy, and then I'll go on to Denise.
Thanks very much, John. I mean, first of all, I just wanted to thank Kate and the team for a fantastic report. It's always a pleasure when these land in my email box. I think they're a real kind of celebration of all the fantastic work that we as a CCG have been doing around reducing health inequalities, particularly for people with learning disability. So well done for that. I'd also like to take the opportunity to commend all of the reviewers as well. It's really, really difficult having this conversation with families and loved ones. Obviously, as GPs, we do that on a regular basis, but I know a lot of the people that are doing the reviews maybe haven't been in clinical practice for a while, and I know it must affect them emotionally very strongly. So, you know, just another offer, Kate, you know, from myself, that if any of the reviewers ever kind of struggle with those conversations, please do let them know from me how much we appreciate what they do, but also if anybody ever wants any kind of support, then I'm always here with a listening ear to help with that. I think the other thing about learning disability is it's really shown us some excellent examples of co-production. Kate mentioned there about the Health Action Plan. That Health Action Plan is now being recognised regionally and is potentially going to the national programme as well around learning disability. So actually in North Cumbria, we should be really celebrating the fact that some fantastic co-production work that yourself, Kate, and the team have done has potentially led to changes nationally and quality improvement for learning disability. So huge congratulations yet again.
Thank you, Mandy.
And the other thing as well, just to bear in mind as well, we've got autism now as well involved in these mortality reviews. And so we're probably one of the first areas in the country as well to trial out some health checks in primary care for people with autism as well. So we're aware that there's a national pilot going on, which has been led by Newcastle University around whether or not we should be looking at autism health checks. But that was significantly delayed by COVID, so that's still an ongoing pilot. So we know people in Newcastle are trialling it out. But we thought this was a good opportunity with our new quality incentive scheme, and I can't remember the title for it, Ed. I'm sure you'll tell us the full title. But our new improvement incentive scheme for primary care, we've actually put in about autism health checks. So again, doing some co-production work now with AAA as well to make sure that we've got some really good resources in place that our GP practice can use when they're trying out these new health checks, which hopefully will start in the next 2 or 3 months. Thanks again, Kate, for all the work.
Thank you, Mandy. Thank you.
Thanks, Mandy. Thanks for that. Some interesting information. Just can I ask a question in terms of the reviewers that you touched on there, Mandy? Just to give a very quick, are they employed by us, or do they come in on a sort of contractual basis?
Kate will tell you. Some of them are CCG, Kate, aren't they? But yeah. I know there's other agencies as well that have reviewers as well.
So we have 2 who are employed via 3 from the CCG. One is on the bank, but going forward, the reviewers will be in a team of people in the ICS, and they're still working on the structure of that going forward. We're not sure exactly how that's going to work. Okay,
thanks for that, Kate. Appreciate it. Denise, and then Louise.
I think Mandy said a lot of what I was going to say. I wanted to say I think it's a tremendous report, powerful. I like the patient story synopses, they're really good. I think the co-production is outstanding, and I think you guys in your team are absolutely leading the way there with the advocacy work that you do with People First. It really is true co-production from the ground up, isn't it? It's exactly what Julie's been striving for over her time, many years here. I think, well, sorry, I've got one question. You taught, there's a few references in the report, Kate, to a change in the sort of structure and the fact that a lot of the mandatory fields we're not collecting data on, and some of it seems like data that we sort of should be collecting on. I think Stomp, and I just wondered how you felt about that, and if there was a risk there.
Yeah, well, there certainly is a risk, and so as reviewers, we speak to a relative GP clinician, and then we have to write a pen portrait. So there's only certain mandatory fields we have to tick, and the rest is just kind of up to the reviewer to put that info or as much information into those 4 different fields. So our confirm and challenge group at People First, like you've just said, Denise, and we believe as well that there's a lot of really good information that should be included that isn't, compared to the old platform. So we've come up with a minimum data set of information that we've recommended across the ICS, but we have assured that that's what our reviewers will be following. Unfortunately, we have a set number of words that we're allowed to put into the review. So so for the pen picture, it's 1,500 words, and if you do 1,501, you can't submit it, so you have to take something out. So it's really quite difficult to put that snapshot of things into the review. But you know, as I say, we've got that minimum data set now.
Okay. And just to finish off, I know it's not that long ago in our quality and outcomes groups, there was lots of concerns about getting reviewers in. We were behind with a lot of this work. So I know you've worked tremendously hard to get to where we are. And lastly, just thanks to Kate, because you did a really good presentation.
Oh, thank you, Denise. Thank you.
Thanks a lot. Louise and then Mandy.
Yeah, so again, obviously, thanks to you, Kate, but obviously thanks to all the reviewers. You know, they all show a real passion and commitment to this work, and are absolutely magnificent champions for all those individuals with learning disabilities. Obviously echoing some of the colleagues' comments, but you know, the whole purpose of these reviews is about learning and improvement. And you know, it transcends a lot of the work that we do, whether it's clinical pathways, whether it's safeguarding, whether it's annual health checks. And I think, you know, the spirit and the focus of the work, I think, actually sets a standard for the way that we should, you know, take some of those things forward in terms of everything that we learn from investigations and reviews. We've talked a lot about the co-production, but I do want to reinforce from a North Cumbria point of view, these reviewers with Nikki and Kate do lead the way in a lot of things. We do take forward even the very recent autism work. We've already reflected back through to the regional team about what needs to happen. So as I say, I think it's another area probably sometimes unsung, where North Cumbria, you know, the team in North Cumbria are actually taking things forward, leading the way and taking forward those improvements. So yeah, thanks.
Thank you, Louise. I'll pass everything on to Nikki and to the team. Thank you.
Okay, thanks a lot. Mandy?
Yeah, and just to tie up, I think the multi-agency panel, Kate, as well, that we now have for leader. So this is you know, we have local authority colleagues there, third sector, NCNTW. So lots of colleagues there on those meetings talking about these cases, which is fantastic to see a really multi-agency approach. One of the things that came up at the last meeting, Kate, was that some of the information that's missing is around some of that public health information, isn't it, as well? And we reflected a little bit on some of the cases last time. I know, and I'm hoping again that'll get fed back to the regional group, Louise, because we are missing a real trick with some of these. You know, so we talked about some very young people, and some of those have long-term conditions, but there's nothing in the current way that the reviews are done to analyse how we're managing long-term conditions in some of these people as well. So I think there are definitely some missed opportunities. We definitely need to keep challenging as a team here in North Cumbria through the regional groups, and hopefully we'll be able to continuously improve then going forward through those forums. Thanks again, Kate.
Okay,
Thank you.
Mandy.
John,
Okay.
I'm going to leave now, John, if that's okay, please.
Well, I was just going to check there was no other questions before you did,
Oh,
Kate.
sorry,
I
okay.
don't need to finish your A-level examination without making sure we put you right through it. I take it there's nothing, but not on behalf of all of us, and I'm not going to repeat stuff, but thanks so much, Kate, for everything you and the team have done. Very impressive.
Thank you, John, and thank you for all your support. Thank you.
Okay, take care.
Bye, everyone. Bye.
Bye-bye. Okay, we just asked to note that and actually approve the report. So note the contents and approve the report. So are we all happy? I don't want to go through a nominate and all that stuff for what is basically a report. We're all happy, I think, in terms of approving that report. Yeah, across the board. Right. Okay. Thank you. Just going on to item 6 now. Peter, it's in terms of CCG objectives, a sort of short update that you've done there, but I'm going to hand over to you.
Thanks, John. So I'll bring Caroline in as well. You are on. Caroline had a slight technical issue, as a few of us have had in the office today, but she's on. Just by way of summary, as everyone is aware, we've done a lot of work around the ICS level plan and formal submission, as indeed each of the local trusts have done work around their formal plans and submissions and so on. But we were really keen, Chair, to ensure that we had a clear work programme for our organisation about what the CCG would be doing until the 1st of July, and then that we had a solid base for a work plan to take into the ICB arrangements for North Cumbria. All of the current CCG teams have done work on their what's called the OGIM, so Objective Goal Initiative Metric plans. So they've kind of been built from bottom up in that respect. And particularly Caroline and Suzanne, some of the colleagues, have helped to group those OGIMs under some key thematic headings. So we've got 7 key headings, which have got quite a close connection to the system priorities that we discussed this morning at System Exec and everyone would be familiar with. And they do also align quite strongly to the governing body assurance framework document and the risk register, because we wanted to make sure that we've got objectives that address those key issues of work programs and risk and so on. So just by way of making this visible to the governing body, in the report that Caroline's helpfully constructed, it shows the 7 kind of themes. Each of those have got a senior responsible officer, which is one of the directors of the CCG. In fact, one of the governing body members of the CCG. And then we'll be moving towards a process of making sure we keep on top of those objectives and update them throughout the year. This isn't a perfect process, but it gives us a good way of checking in and taking stock of progress. And as we're currently in the process of agreeing everyone's annual appraisal and their individual objectives, this is quite helpful because it then aligns to individual objectives so everyone can see how they're pulling together and contributing. So that's kind of all the paper sets out. We thought it'd be helpful to bring it here to make visible and seek some support from the governing body. But Caroline, she's just on my right. You obviously can't see that. But Caroline, you may well want to either correct something I've just said or add further flavour.
Nothing really to add, other than we just noted that there's a bit of a risk about the structural change we're going through at the moment, which may mean that we need to adapt our OGIMs as we go through the year, and inevitably things happen during the year, which we would obviously want to bring into CCG objectives as they arise if they're significant for us. But otherwise, no, it's just to ask the governing body to approve the high-level priorities and the associated objectives, and you haven't got the detail of them because there are some 75 of them. But I can assure you Charles had a really jolly afternoon mapping all the objectives against the assurance framework, which made sure that we had at least one objective associated with each of the issues that we've identified on the assurance framework. So we've got a good relationship between the two. So thanks very much, John.
No, thank you both. Any comments, questions from anybody? Okay. Again, I'm not going to ask for a secondary proposal for this particular item. I just want to make sure that is there anybody in disagreement about the request to approve and support, which was the idea behind this report? Yeah. Okay. So full approval from the governing body members for that, and they say good luck with it. It's a tough ask, as we were talking before. There's a number of things in there which will take some doing, but we know, as we've said earlier, the staff here are more than capable of doing that. I'm going to go on to financial plan now, and Charles, it's just a bit of an update, and I think you're probably going to outline the fact that it's more for ratification than anything else because it's been approved at the finance and performance in line with what we said at the last meeting in terms of where we want to delegate it. But I'm going to pass it over to you.
Exactly right, John, and apologies, I should have said it was for ratification and not noting as it says in the report. I'm not going really to go through the report in any detail because that was the role the Finance and Performance Committee undertook. I'll set out the plan has been consolidated into an ICB wide plan with the assent of the bill. We'll be responsible for this expenditure until the end of June, and then the plan passes across to the ICB. And reflecting that approach, but also I think more importantly, reflecting that 22-23 for the whole of the NHS is very much a transitional year for finances as we move out of COVID and hopefully more towards a business as usual approach. There has been a uniform approach taken across the ICB to do this, which has meant by just following all those rules and also the impact that has on our expenditure, basically the mathematics of it would mean it would be very difficult for us as a CCG, given where we started from, and particularly the collective approach to funding NHS providers. It didn't really give us anywhere to go without doing something absolutely. I'm trying to think of a word that I can say in a meeting in public, but rather short term and foolish, that wouldn't be very thought through or probably implementable to give us a balanced position. However, reflecting that and the work across the ICB, there are other surpluses in other areas that bring the ICB into balance. So that's where we are. I just alert everyone to one statement in the cover sheet, really, which was to say this formed part of an ICB plan that was submitted and was subject to no material changes. Well, I was on a national briefing at the back end of yesterday afternoon, and I think something official is going to come out, but there are potentially some material changes coming up. So the background to this is that when all ICBs put their latest iterations of the plans in, there was actually I think the majority of them, based on the information that we had, were showing deficit positions at ICB level, Integrated Care Board, or ICS level, including the providers. There are a number of reasons for that, but basically, as far as the NHS is concerned, it cannot afford that level of deficit in the current year. However, what was acknowledged was that when the planning guidance was issued, there were a number of cost pressures that were not reflected in the planning guidance, and the most obvious one is just the increase in inflationary pressures owing to world events, and particularly issues such as the increased cost of energy, which has gone up and wasn't included in the uplift. So we're expecting this to be announced today, but it is in the HSJ, so it must be happening. And basically, there's a further 1.5 billion going into the national system, which comprises of four elements. So there will be an increase in, I'm calling it the tariff, if you like, paid to NHS providers, just to reflect some of those inflationary pressures in that everyone's got them. There will be a specific increase for ambulance services for the cost of employing more call handlers that was actually, I think a lot of that was funded in the last financial year, but hadn't been confirmed as recurrent. So I know in their plans, Nhs, for example, put in an expectation that they would get that funding, but they weren't in a balanced position because it hadn't been announced. On top of that, there's some extra funding for things like people might have seen the increase in NHS funded nursing care cost. That was announced last week, a significant increase in the national rate for that. I think it was about 11%, which nationally we were told, and including our plans, to plan 4.8% for continuing healthcare, and we had assumed a similar amount for NHS funded nursing care. So there's an increase there. And finally, there's an element, so there we understand those will all be divvied up just based on population size and allocations across ICB. There's a further amount, which is about a quarter, that is going to be more discretionary. And the reason for that is that there will be across the country some very specific cost pressures that don't apply to everyone, but relate to some specific contractual obligations. So I'm not quite certain exactly the local arrangements, but most PFI contracts have an annual inflator that is either based on the retail price index or the consumer price index, sometimes plus another percent, which up until relatively recently, when inflation levels have been low, wasn't particularly an issue. But that's built into the contract. So if you've got a PFI hospital on those terms, no matter what you do, you're still going to have to pay that across. So it's recognised there will be some specific local circumstances, probably everywhere, where it would be, if the money was just given out sort of across the board, some people would get a windfall gain, and some people would have a bit of a cost pressure, which I guess mirrors some of the national economic conditions we see at the moment between individuals and some organisations. So that's going to come out. We're going to get some more details of that imminently, hopefully in the next couple of days. My gut instinct is that the expectation is that this funding is to reduce the planned deficit, not in the main, and there'll always be one or two exceptions, to cover new risks that weren't in the plan. Because the reason we've got a deficit is because of some of these unavoidable costs that haven't been funded. So if they are funded, you'd expect an improvement. And on top of that, there'll be further work to be carried out over the next month or so, looking at other opportunities to reduce costs, and there will be some national initiatives to do that. So I think under COVID, particularly for providers, some of the national rules about agency costs and things like that were suspended, and they're likely to be coming back in. But we'll get more details of that. So I don't think it will make a massive difference to our position, because my broad expectation is if we get money in, we'll get an equivalent amount of money going out, because the deficit is in the main in provider organisations rather than CCGs as a whole in the ICB. So I'm proposing that we will work through that and we'll report that to the Finance and Performance Committee in June. On top of that, it's just to note, which sort of relates back to the last item, that part of this national plan is also to look at the activity, and that will also be looked at as part of this resubmission, which is actually, again, quite a valid issue, because when the plans were put together, I think there was a view that COVID would be having much less of an impact than it has in the early months of this financial year. So we have still seen significant numbers of people, not with health problems, as I think Julie was sort of mentioning, as bad as they were experienced previously, but we've still had significant numbers of people in hospital with COVID. The rules about infection control and prevention and how we do that are being reviewed, because compared to pre-COVID, rightly they have an impact on, for them to be meaningful, we must be doing things in a different way, so they're being looked at again. But it's believed that has compromised some of the activity, and certainly again in the provider sector, when nationally they looked at the what were in the draft plans for what was going to be done in April versus what was actually done, there's been a bit of a difference. So basically this is a national issue to try and reset the plan. So appreciate that's all been a bit off the cuff and not written in the paper, but it is literally so it isn't even in the press to get it off the press. It was the basis of some of the updates we got last night, but I think that's the case. However, putting that to one side, we still need to manage our finances effectively in in the weeks we've had in this financial year as a CCG, where we've effectively been working to this plan, and in the next few weeks anyway. So I think materially the plan is for the year, because when we did it, the act hadn't gone through. In reality, any changes to the plan will probably have more of an impact on the ICB for the remaining 9 months of the year rather than the CCG, but we'll have to go through the process. So apologies if that was quite a lot to take in over and above what's in the paper, but I thought, given the context, it was quite important to share that.
Thank you for that, Charles. Are there any questions or comments from colleagues? Okay, thank you. I mean, we are asked, I think, as you said at the start, it has been approved in order for it to go to the ICB by the Finance and Performance Committee in April. So I think you're just asking for formal ratification from the governing body, obviously sight of that, and to know what has happened, as Charles has just articulated, alongside some fresh information which he gave us as well. So are we okay to ratify that? Yeah, in total agreement. Anybody who's dissenting? No. Okay. Thank you for that, Charles. Appreciate your time, and appreciate your time as well, Caroline, on that. I know you've been involved in, obviously, from the performance side, so appreciate it. Just then, in terms of item 8, now we had, if you recall, our initial long discussion about this at when we met at Botcherby in person. Oh my gosh, how long ago was that? And quite rightly, there was including myself, a number of us, getting a bit vexed and just trying to work out what was going on and all that, all that anxiety. What we're actually being asked to do here, I'm going to change slightly from what's on the report, and it's just to do with the amount of information that's coming in pretty quickly as well. You should all have had, firstly, a copy of those sort of governance documents that sort of outline the handbook. There's a set of those, not all complete, of course, but there's a set of those, which was part of what we agreed at our meeting when we discussed this last time, just to get aware of that and see what's happening with that. The other side to it in the report, it does ask for, because we didn't have the Constitution when the report was done. The report came in sometime, I think, yesterday. The Constitution, sorry, came in sometime yesterday. So whilst we were asking on this report for delegation to myself and Mark, so we could respond within a week to get it back, I suppose what I'm asking for now is, now we've got it, and I have been through it in terms of what are the changes, and if you've had a chance to go through it, you'll see that there's some things in there that are different colours. There are text box changes from the last version, which are very clearly highlighted. There's some colour coding of blue and green. Blue that's the required wording nationally, and green meaning that's the locally determined, how we could put something in from a North East and North Cumbria perspective. I've looked through it, and there's nothing in there that kind of worries me in the slightest. Although I do really think they've got a bit of a challenge on about how they're going to use the process to get 2 members from 358 primary care service providers across North Cumbria. Across North East and North Cumbria. That will be a challenge to get those representatives. So I was just sort of trying to work out whether or not we wanted to have a conversation about it. But my other proposal, rather than delaying that delegation to myself and Mark was to say, look, we know the situation, we know it's a constitution, it does what it says on the tin, it creates that framework, whether we could support that now. But I know you've got your hand up, Colin, but I just wanted to make sure before I introduce you. Charles, have I added anything there, or do you want to add anything to that? Because it was your paper and I did have a quick chat with you, so I'll give that background.
Not really. I think you covered it. I just wonder, John, if in terms of, I would fully support in the spirit of the guidance, as you say, and I've just thought of this as you've been speaking, so not when we had a quick chat beforehand, is I would fully support that this is approved by the governing body rather than under delegation. I just wonder if we give approval in principle today to do that, if that is what we choose to do, but maybe subject to governing body members, because maybe not everyone's read it, just having a quick look through and say, if people have any reservations, to get back to yourself by the end of the week, just then, because if we are going to do it, we probably should make sure everyone's had a chance to read it who wants to.
That's fine as well, Charles, in terms of that, because as I say, I literally went through it this morning to try and pick out what it was that maybe concerned me. Yeah, okay, so just Colin, you've got your hand up, so I'll go to you first, and I'll just then take any of the soundings on those two kind of proposals that have been put forward.
Yes, what I would say, John, is I've scanned the document, but it will not surprise you that I too went to section 3, subsection 1, little 2, yada yada, the joys of constituency, and quite frankly read it 3 times and just gave up. I just gave up, and quite frankly, I've been doing this for a while, and I would say out of 300 plus possible GP board members, if and you looked at their service and what they've done, if I'm the kind of person who's given up, then there's a problem there. And I think we should do the ICB a service and say the Constitution should be able to be read by those in that section who are likely to be the least bit interested in holding to it. I think I came out with the idea that somehow the chair is appointing, but we can't go into all the details. But it was peculiarly probably very clear to our managerial stroke folks who live in this world, but peculiarly unclear for those who it might be of any relevance to. Which seems to be pointless. However, enough of my venting. I think we should, and it would be as wise, either through the good offices of Mark or informally through yourself, John. No doubt you've got your own contacts, to say we'd like it possibly to make a little bit more straightforward sense, and the quicker the ICB makes plain how the whole structure is going to work, the better, because I think that what I would say to folks on a general basis is, as the weeks and months go by and there's no clarity on this issue, the Constitution and all other things will become less and less relevant to GPs. Quite frankly, we're going to a dangerous vacuum, John. But I'll leave it with you. I know we've got the full council of members planning meeting tomorrow, and maybe we can try and to make some more sense for it for those who might want to come to the last full council of members meetings, or at least for PCN CDs or anybody in our area who might be the least bit interested in thinking they could have some input to this, either through 1, the positions, or 2, the structure in which the ICB should make clear they will be supported. Sorry if that's a bit of a rant.
Yeah, no, I think the one point I would say is that there is a time scale on this, and I think, correct me if I'm wrong, but Brenda might be able to tell me if I am. It needs to be done. There's a formal meeting on the 27th of the 5th, which is next week, I believe, where I think they're looking at the handbook and the Constitution for sign off. So there is a very tight time scale. I've got those dates right. If there's anyone who can nod on that. I think the bit around two things that you mentioned there, Colin, or a number of things, but the two main things is, one is I think we've got to be very specific about the constitution, which I think is different from how the ICB is going to work. I think that the constitution gives a framework. The ICB working, I think, is much more involved in potentially the operating framework, and obviously some of the things that were in the handbook as well in terms of the detail of it. So I don't want to sort of raise expectations that, you know, how much can we do to influence this, but I think if there's something there that seems unclear, then I think that that's a useful bit of feedback, say that seems unclear. But in terms of dotting I's and crossing T's, I don't think that will probably be land very well. I don't think we'll be able to make that land. It's about saying we need to make it clear. But I've got a couple of people now. So I'm going to go to yourself, Charles, because obviously it was your report. Then I'm going to go Carol, then I'm going to go Peter.
Now, just to follow on from Colin, my suggestion would indeed be that we've got a short timetable, and inevitably constitutions and such documents are very legalistic. But if we were to provide some feedback, given the size of our ICS, ICB in particular, and the big variety of its population, I wonder in terms of feedback if there's a bit like a number of organisations, particularly those who support people with a learning disability, will often provide to accompany the formal documents a sort of easy read version about what the key things are, and maybe that's something our ICB colleagues might want to think about as in parallel with the formal documentation, just to put on the ICB website about how what this really means, as opposed to what subsection 8 sub little 2 or whatever Colin was referring to might just be a way of helping to feedback in a constructive way. That was my only observation.
Okay, thanks for that, Charles. Carol?
I was something similar to Charles. What would really be helpful is like a 2-page that says this is what this document is actually saying. I mean, I know it needs to be legal, but it's a 64-page long constitution, and followed by or associated with a governance handbook, which is actually 17 documents. I'm sorry, but with the best will in the world, I have 6 weeks to go and I'm not reading that governance handbook because it's completely ridiculous to be such a huge document. I know it has to exist, but you know, when you look at these documents, and we're supposed to be about an NHS which is inclusive and is enable for everyone to access you know, what we're about and how we're about. These documents are written in such a way that it makes it very difficult, even with people, you know, with PhDs and masters and God knows what, to actually follow them through, you know, and keep going to the end. So I do understand what Colin is saying. So my points are, firstly, if there is a kind of summary of exactly what it's saying, and even refer you to the page numbers, you know, that would be really helpful. And the governance handbook is just, yeah, sorry for those people that have to work through it. It's enormous. Good luck with that.
Yeah, I mean, it's very similar to ours, just so you know. So, okay, got a bit there. Peter?
Thanks, Chair. I was going to begin with the same observation you just made. Were you to read the current NHS North Cumbria Clinical Commissioning Group Constitution, you'd probably have the same kind of feelings about it. You know, there's something inevitable about these documents, how they're constructed, isn't there? All I really wanted to say, though, Chair, was just a reminder about what we're being asked to do. So we were asked to, as a CCG governing body, recommend to NHS England the approval of this constitution. We already did that. There are now some fairly small amendments, some of which have been nationally determined, to the constitution. So we're being asked to confirm that we would still offer our recommendation. So I think the first thing is, unless there's any reason why we wouldn't, I think this is what perhaps in the framing that Charles offered, I would suggest that we should still be confirming that we recommend to NHS England they approve this constitution, unless anybody can see anything material that would change that. And I think there is no such change, by the way. That's entirely separate from, we might want to make a positive offering to our ICB colleagues about what they do with this and how they might frame it, etc. But I think that is a separate issue and not technically the business of the governing body. Carol, just by way of reassurance, there is some work that will be done on a more straightforward description of the new ICB operating model. Because in all seriousness, it is quite difficult to get your head around this. Your point's absolutely valid. I just don't think that's the business of our governing body for today, Chair.
Yeah, and I would agree with you, Peter. Mark, I don't know if there's anything you wanted to add from sort of your perspective and obviously involvement as well.
So I think Peter's really well summed up the scenario. I mean, these, in a lot of ways, without reiterating the conversation, these documents are what they are. They are intended for a specific purpose, and they are large, complex, and detailed. But equally, given the fact that they are, there are still some elements that that would benefit from some more understanding and some more clarity. I think it's entirely within our gift to positively in a helpful way point that out. But I think Peter is right. I can't see anything in the document that would materially affect our decision not to continue to support it.
Okay. And Charles, just in terms of anything from yourself, mate, just are you saying the same thing? Right. Okay. So with all that in mind, and I knew where we'd get to on this, by the way, so it's okay. There's nothing that you said that surprised me. What I'm going to say is now we've got it. Bearing in mind Charles's comment, I think that I'm proposing, to be fair, I'm proposing that we do approve it with those amendments. If there's anything that anybody other than what's already been said along the lines of it be helpful to have that background document or information, which is Peter's point, which is ancillary to, separate from what we're going to do, is that I'm saying that I think we should recommend to NHSE through the ICB our support for this constitution going forward. And then there's some people already working on, I know, because I know Peter's had a look at it, I know Charles had a look at it, I know that Brenda's involved in it. Anything in terms of helpful comments, either on the Constitution or the Governance Handbook, that we can get back to the ICB for their meeting on the 27th. So that's kind of where I'm at, really, which I think echoes probably what Charles proposed after I outlined it all. What's people's feelings with that? Bear in mind, I'm not asking for approval, I'm asking for a recommendation. People feel comfortable, or are they feeling uncomfortable? Is silence kind of an acceptance?
Recommend approve.
So is there anybody who says that dissents from that proposal? Because if there is, I just want to make sure it's captured so that I'm very clear. Okay, so there's no dissent from that. Is that we're saying we recommend to NHS England the approval of the Constitution, and then separately we'll work on in the next few days anything that we can send back that might be helpful to support the implementation, the structure, all the guidance that might be needed to help people understand what's going on. Okay, but that's happy with that. Okay, right. You went down there, Colin. I didn't know if that was like just trying to disappear from view. Right, that's fine. Okay, we'll move on. Thank you. I'm going to go on to your maternity report, Louise, item 9. So over to yourself.
That's great, thank you, John.
You're in the background there, Louise. Your mouthpiece must be around the back of your head.
I'm here, thank you.
There you go.
Thanks, John. So obviously, hopefully everybody has read the document. It is, I suppose, of necessity quite a detailed document. So just to focus on what the purpose of the report is really. So everybody be aware that there was an initial Ockenden report in December 2020 with some immediate and essential actions. Secondly, we've had the publication of the final report, which was on the 13th of March this year. And in respect of, I suppose, one of the key focuses certainly for ourselves as a governing body and in our role as a CCG about what our role is in terms of our commitment, in terms of oversight and assurance in maintaining that current pattern of safe and effective maternity care for the women and families in North Cumbria. So in respect of part one, there has been obviously some regular requirements around submissions from NHS England for all trusts, including our own. And we are currently, and I'll say we, that's the regional team, representatives of the local maternity services, which obviously includes CCGs, undergoing a series of assurance visits. And the intention of those assurance visits across North East and North Cumbria is to basically triangulate the self-assessed submitted evidence with those discussions with exec teams, staff and families on the ground. The North Cumbria visit isn't due until the 7th of July. So I can't update on that, but obviously what you'll see in the documentation is that the trust are compliant in terms of their evidential submissions with the majority of those. And for the ones where they're not able to currently demonstrate compliance, that is really on producing the written documentation evidence to support it. But obviously from a CCG point of view, I would suggest gives us a level of assurance in terms of not just the response, but also what we also know, which is the action plans, improvement plans and ongoing work that's happened in the trust to support the delivery of those essential actions. The second part is clearly there for, in a sense, information. It tells us, as has been widely reported in the press, around the many circumstances that the review team at Shrewsbury and Telford found, and obviously also that indication, as is attached in Appendix 2, that there are now additional set of essential actions that each of the trusts need to undertake. I can say that in respect of that, unfortunately, we are also due again a report from East Kent and also from Nottingham, and the intention from a national and regional perspective is then to review all of these actions and to all intents and purposes put them all in one set of actions for which clearly there will be ongoing assurance. So as I say, the second part is really for information following the publication of the final report. And the third part, which as I say, is probably the pivotal part as far as the governing body and CCG are concerned, is what our oversight and assurance looks like, what that's looked like over the year. I'm not going to go through all those bits of evidence, but again, continues to provide that assurance, A, that we've got oversight, and B, in terms of that ongoing assurance, and including obviously the work of both the CCG and the LM&S in relation to all the work around maternity services and Ockenden plans as well. So I'm happy to leave it there, John. I would just like to thank sort of Julie and Carol, who have sort of supported sense checking the report, as well as obviously all the contributors from the nursing and quality team as well. Thanks.
No, thank you, Louise. And I think it was a very useful report as like a marker on the ground at a certain time to say this is what's going on. I think it's very useful. So comments or questions from anybody? Okay. Yeah, and I know we did have the briefing as well on Ockenden to support this. So this is not just landed on us today, as it were. You know, So,
Yeah.
okay, well, I'm not going to labour it if there's nothing other than to say thank you again to you and your team, Louise, for this, and thank you for as well as the work involving that assurance work and that interactive work, both at a regional level, and North East and North Cumbria level, and also with the trust as well. You know, because I know there's a lot of work going there, and it's not easy. It is not easy, and it's a very, very delicate and sensitive subject for obvious reasons. Okay, right. Well, we were just asked to note that in terms of a few things, that obviously the compliance, the publication of the final report, and our role within that as the CCG, the oversight, and that wider partnership. So, okay. Well, thank you very much for that, Louise. Appreciate it.
Thank you.
You're next on as well, because obviously we've done Julie, and you're on to a verbal update on the quality report, Louise.
Yeah, again, thank you. So just to reference that our Quality and Outcomes Committee has sort of fallen out of sync with the governing body, so we're not actually meeting till next week. So obviously in relation to I suppose some of the key issues, you will see obviously later on in the governing body minutes report, sorry, that the performance information is already included in there. I think overall, you know, we continue to see the pressures that we related with COVID starting to ease. I suppose notably, for example, in the independent sector, we are now only with 3 nursing homes with outbreaks and 2 residential settings. You know, if you compare those to the figures earlier this year, which were in the 70s and 80s, you know, as we're seeing right across the board, we can see the improvement. So that is really positive, and obviously leaving on to a lot of the focus around, I think, what we're calling the reset work. And colleagues on this call, I think, will be aware that we've had some of that health and social care reset conversation as well. So, and that is directly linked to the fact that from a medically optimised point of view, the figures remain particularly high. As of Wednesday, last Wednesday, we still had 132 medically optimised in beds in North Cumbria. So, as I say, hence the really helpful reset conversations from health and social care to start to look at how we can make those improvements and make those challenges. And obviously we can update on that in the full report to the governing body. Just 2 other sort of quick points. It does reference in last month's quality report around the concerns to do with weights. Again, this is obviously linked to the issues around flow. I can say that the nursing quality team, with the support from Deb Lee, did undertake an assurance visit at the Carlisle setting. And actually the outcome from that was quite a positive report. Positive in the sense that patient safety was being kept as central, and a lot of the mitigations, if you like, that we had heard about to protect that patient safety were actually seen as visible on the day. So we've shared that report with the trust. There were 1 or 2 recommendations, but we are now planning to do a similar visit to West Cumberland Hospital next Wednesday on the 25th. And again, obviously, we'll be able to update on that. But as I say, I think from a patient safety point of view, some assurance around obviously that very, very concerning issue. And again, we're about to finally undertake shortly the work that we've signalled in terms of what we call the harm reviews, in terms of people on the waiting list, particularly those in relation to a backlog. And again, aim to report on that in terms of assurance. We may not meet the June governing body target for that. Again, some assurance that that work is underway, and obviously we'll supply more details at the board in March. Just finally, again, just to note, obviously, in terms of all the changes from an ICB point of view that we've talked about a lot today, there is work underway already to establish the System Quality Board, and that is in essence a replacement for what we currently know as the Regional Quality Review Group. The main difference for the System Quality Group, as per the guidance from the National Quality Board, is that the membership will be much broader. And so at the QRG a couple of weeks ago, That very much included our local authority colleagues in starting to shape that discussion around that quality committee. And then the ICB will also be setting up a quality committee. And I think, as we've heard, and obviously is clearly a key focus of ourselves in relation to lived experience, but also into that inequalities agenda will be one of the key areas around that quality committee. I can say, I shan't say who it is because I don't think it's publicly announced yet, that the ICB have been successful in appointing to a chief nurse post, and it will be that chief nurse that will chair both the system quality board, system quality group, and the quality committee of the ICB. So I suppose some positive developments, and we've shared today our system executive, Suzanne's on the call, done a lot of work about, I suppose, refreshing our approach to quality within that improvement framework at place, and we will continue to progress those developments while the ICB arrangements develop. I'll leave it at there. Thanks, John.
Thank you, Louise. Very comprehensive. Any questions or comments on that? Bear in mind, obviously, what Louise has said. We'll get the report at the next meeting. Okay, well, that's really helpful, Louise. Particularly that bit around the quality side of things as well. Okay, so anything? I'm going to shift us on to now performance. You've got two here, Charles. Performance and then finance report, and obviously this is the performance report, should we say, from April, and we actually had the performance meeting yesterday as well, so for May, so it's coming almost like going back a step, but I'll let you carry on.
Yeah, no, you're right, John. And again, a month ago, this report was covered in detail. So I'll just bring a few key highlights out, and it's really important as well to know the briefing with a lot of those issues go hand in glove with the briefing Louise has just given us. So the performance report that we see, I think, reflects particularly the emergency care situation we've experienced and to be fair, continued to experience during April with some very significant pressure levels, and particularly the concern about the 12-hour waits in A&E. Although on a positive note, a family member attended A&E last night at Cumbria Infirmary and was in and out within an hour, having had quite a complex issue. So there are some good things there. I think the other thing I would really like to highlight in a meeting held in public is the work that was undertaken at North Cumbria Trust regarding the long waiters and eliminating 104-week waiters in the last financial year, which given where we started off and the challenges pre-COVID on waiting times, I think that the trust really need to be commended in the work they did to achieve that target. I think on other hospital-based measures, we saw the hospital discharge programme ended on the 31st of March. So we've been doing quite a lot of work with our local authority and trust colleagues to look at initiatives that we can put in place to continue some of the good work we could do locally in, given the challenges we face with that funding, that national funding disappearing. Were there other ways we could apply some of the figures we talked about in the financial plan in doing that? We're still working ourselves, Morecambe Bay, Ccg and the local authority to try and finalise that, but we're hopeful that some of the arrangements that helped alleviate some of the challenges didn't exclude them totally, as Louise was talking about the number of medically optimised patients. But I think what we're trying to do is everything that we've done that has been successful and contributed. Is there a way we can continue to carry on? just again draw attention to the NWAS figures for the year, and it would be obviously better if across the Northwest and North Cumbria all were green. But I think in terms of the experience we have in North Cumbria, even when the targets haven't been met, generally we've not been far away, as opposed to what we see in other parts of the patch. Although April was particularly challenging for the ambulance service. And the other thing in terms of the work we're doing, I would like to flag is the work, particularly under Mandy's leadership, about the dementia diagnosis, where I think what we found was the symptoms rather than the cause. So the symptoms were, it seemed the issue seemed to be related to referrals from GP practices, but when we actually sat down with that task and finish group, it was looking at capacity all the way through, and our colleagues at CNTW have identified that and have tried to change some of the way they deploy staff to do that better. And also this work was done looking at the using health pathways as a way of actually supporting things which helps signpost our primary care colleagues the best way to refer patients. So it's been an area that has been a challenge for a long time, and good to see that we've been able to do some positive work there. I think the other issue that I know is exercising the trust NCIC considerably is the challenges of getting the cancer plan back on track. Although again, hopefully some of the extra diagnostic capacity that again we weren't certain if there would be national funding for, that is in place over the year, will help us with that. Although to be fair, it'll probably be more towards the back end of the year where we see the impact. So I'll just pause there, John.
Thanks, Charles. Mandy, you want to ask a question or a comment?
Just a comment first, John. Thanks, Charles, for highlighting the work of the dementia group. What we do have, John, just so that you're aware, Susan Gallagher, who's obviously a member of our public, who's sat on many of our governing bodies in public, is a key member of that group, and her contribution has been absolutely amazing. We've got primary care colleagues there, so we've got at least 3 of the PCNs involved with that work, and local authority colleagues and CNTW. So a real co-production piece of work going on there around dementia. Unfortunately, if you look at the data, it's still not looking great, but it's going to take a little while to turn that data around because of the current waiting list that we've got. But we know we've got a plan that we think will work, and we just need to keep going ahead with that plan. The other thing I'm aware, obviously, we do have still very long waiting lists in our elective system with NCIC, but I'm just conscious that Caroline's here with us, and I just wondered whether it would be worthwhile touching on the work that Caroline and Helen are now doing around Waiting Well, which has now been renamed Preparing Well, which I think is a really nice way of looking at it. I think Preparing Well is a much more kind of positive way of looking at it, so well done for renaming it. So whether it's worthwhile bringing them in, John, just to give you a flavour of where that work's going.
No, absolutely. So is that Caroline and who else was it?
That would be me, Helen.
Helen, sorry, Helen. Welcome, Helen. So I don't know when you joined us. It's I don't keep a weather eye on every single screen bit, but I hope you've been with us for a while. I know you weren't here at the start, but welcome.
Yeah, no, I've been here since beginning. I just can't get my camera on, so I apologise about today. Okay. So I'll let Caroline keep me right, but it's very early days with the Preparing Well work at the moment. We have a little steering group put together with myself, Caroline, Quentin Kingsbury, who's one of the consultant anaesthetists in the trust, Leslie Jones, who's public health consultant for the trust, and the lady from Cumbria at CVS, so voluntary.
Claire Edwards.
Claire Edwards. So we are just starting to develop what we think the Preparing Well service should look like, and we were having a discussion this morning. There is a business case that's due at the beginning of June, sort of with a preparatory idea of what we're going to be putting in place over the next 12 months. So that work is ongoing. Caroline, anything else you want to add to that?
I think just to say that what's really positive news is, along with all the ICP areas in the northeast North Cumbria, we've got an allocation of funds to support a proof of concept year, which 22-23 will be, and that's what the business case is for. We don't have to kind of bid for allocation, because that allocation has been made to us. We're getting the best part of £200,000 for North Cumbria, but we do need to demonstrate what we're going to do, and to also agree that we can deliver against a core minimum data set of information that will help us monitor the progress. And I think we've been greatly helped by the fact that through some of the Transformation Investment Fund monies from last year, the Trust has been able to, NCIC has been able to invest in a system called Lifebox, which is designed around pre-assessment and post-operative follow-up, that will mean that we've got a really good vehicle for getting in touch with those patients who are joining the waiting list and following them through. So what we're just trying to work out this morning is, how do we identify the target group for this year, who are patients who are on the waiting list and are categorised as P4. For those of you who don't speak operating list classifications, that's patients who are deemed to be fit to wait for a minimum of 3 months. We're also looking then at, amongst that P4 group, we're looking for a subset who are in deciles 1 and 2 in terms of deprivation, those with a learning disability, those who are smokers, who are overweight, those we're adding locally. We want to add in high blood pressure, because that's the main reason why people are knocked off from their surgery at pre-assessment, and atrial fibrillation. So we're just working through what that number will be for us in North Cumbria, and therefore the scope of the project. But the nice thing about the Lifebox work that the Trust are doing is that it means that everybody will be getting a form of Preparing Well, because they will get information about their surgery, about what to expect before and after, especially in terms of recovery, and what they might do to support themselves in getting ready for that. So it's come at a really good time for North Cumbria with the work the Trust are doing. Thanks, John.
Yeah. And I think, just adding to that, whereas we're being encouraged to focus on that particular high risk group, we are going to, with using Lifebox and working with the Trust, we are actually going to have a focus on everyone, which I think is really, really important. And the other very positive thing is that we already have a lot of the services and links with voluntary services or other providers for all of the work that we need to support these patients in the Preparing Well. So, linking back to what was said earlier in the meeting, all the work that's been done through the comms team and through the patient engagement and through engagement with voluntary sector actually will help support this piece of work quite significantly. So very positive North Cumbrian bit of work, I think.
Fantastic. So, I mean, and in effect, we're talking using a bit of a health inequalities approach to support people prior to their intervention. One question I was just going to ask, and I suppose maybe to yourself, Caroline or Helen, is, are Active Cumbria involved in your group at all in terms of?
Not yet, John, but they're on my list. Yes.
Okay, that's okay.
Yeah, they definitely will be. Yeah.
No, that's fine. That's fine. They will welcome the call. I know that Bruce will welcome it, because I think it's something that certainly I know down in Manchester is very much, in terms of cancer preparedness and coping, a lot of activity there with their sort of leisure support activity services, as well as like the NHS. Okay, fantastic. That was very good, and I like the little sort of segue there into that. That was very, very useful. Charles, are you okay in terms of where you are with the performance report in terms of presentation?
Yes, I am. Thank you, John.
Yeah. Is there any questions or comments about that from anybody else? No. Okay. Great. Then you're on again, Charles. We just asked to note that, so we will do. And then on to finance report.
Yes, thanks, John. So it's always a bit of a strange one that we spend all year providing quite detailed reports about the finances. Then it gets to the end of the year, and we sort of say, well, it looks like this, but we wait for the auditors to finish. So we'll keep our powder dry until the accounts have been complete. Although it's important to say we have completed our draft accounts. They have been submitted to NHS England in accordance with the timetable, and as we speak, our colleagues from Grant Thornton, our external auditors, are currently undergoing that work with the expectation that during June they will be approved and accepted by the audit committee under the delegation they have from the governing body. So we're all on track for that. However, we don't do a month one normally anyway. And going back to some of the issues that I touched on the earlier financial planning report, it would have been nigh on an impossibility to have done that this year. But anyway, let's move on from that. So what we've just provided is while these are draft figures, what we anticipate, what we've put in our draft accounts, which to me says we were pretty much where we expected to be. The final position was slightly different to what we planned, but that was because there were a number of issues that we probably or well, not probably, we haven't sought to resolve with some of our local organisations, notably North Cumbria, many of which relate to the former Cumbria Partnership Trust, that we took a view moving into the ICS. We just needed to sort them out. So that was those adjustments were made with full knowledge of NHS England and in the context of the overall ICS ICB plan, because the idea is really just to try and given organisational memory, people doing different jobs, just to try and reach a straight edge, for want of a better word, in respect of the CCG. The other thing, just to note, as we've had a few sort of congratulations, as it were, this afternoon, or commendations, would be just to note that the cash position, where basically we manage the cash to within 1% of 1% of our expenditure figure, and the person who's responsible for that is Lynn Coates from our team, who is retiring in July after nearly 50 years in the NHS. So just think we should know that.
Yes, thanks very much, Charles. Yes, congratulations to Lynn. 50 years in the NHS. Yes, very good indeed. Okay, any comments or questions from anybody on that? Okay, we note that as well then. Thanks, Charles. Right, we're nearly there, guys. Just in terms of item 14, just the minutes of the committee meetings. All I'm going to do is, if there's anybody, say, from the audit committee who wants to pull anything out from those 4 sets of minutes, or any questions about them, I was going to ask. No, okay. Executive committee, there's 2 sets of minutes. Mark, obviously, I think you chair it, although I know Charles chaired one of these. Anything anyone wants to mention? No. Okay. Finance and performance, which is me. I've been through them. There's nothing there I want to pick up that we've not already known about. There's nothing, as we've heard from Louise, in terms of the qualities, outcomes and quality assurance committee, because they've got their meeting soon. And primary care committee, there was nothing on there that I wanted to pull out from the 16th of Feb. So minutes of the wider system, I'm moving on to. Is everybody happy for that? We'll move on. Yeah. Okay. Minutes of the wider system, Cumbria Health and Wellbeing Board, 4th of March. A couple of things I just wanted to note on here, just for people's information. One is that our designate chief executive for the ICB, Sam Allen, attended that meeting and gave a presentation about where we were up to with the ICB, and met so members of the Cumbria County Council as well. Also as well, it was another opportunity to, and I keep reinforce this, to make sure that we were up to date and up to speed with what was happening with SEND and the SEND improvement plan. Just out of interest, does anybody know if an inspection has occurred yet or not? I know that's no. Okay, so I just want to make sure that you can have a look at that. And then the other one was just about a bit of an update about the Health Equity Commission. We talked about Michael Marmot before, but I think everybody may know that the report was supposed to come out in April. There is a delay on it. It's possibly going to be June. And I know that Peter's been doing a bit of work on behalf of us as NHS partners up here in North Cumbria just to try and connect some people into the project so that we're ready for receipt of that report. I don't know, Peter, is there anything else you wanted to add to that's necessary at this moment in time?
No, thank you.
Okay, that's okay, Peter. And then there's just some short extracts of minutes there for the joint committee. And again, I'll just stress, in terms of the joint committee, you'll see on the part 2, it's changed more into a development session, I would have to say, in terms of interaction with members of the ICB and where we're up to. So that's where we are with that. And then the only other thing you'll see there is the joint committee's annual report, which just that's what we've done during this year. So it's there for you people to read. So I just wanted to ask Brenda, I haven't received notification from any members' questions from the public at all, unless you have anything.
Yeah, I've not received any, John.
Okay, and just and I don't think there are any members of the public on at the moment. If I can, if there are, please, if there's any questions. No. Carol, you want to ask a question? Is this as a member of the public or as a lay member?
I don't know. It's a member of the Primary Care Committee from yesterday. I'm sorry. Did you update the governing body as a result of the yesterday?
Item 17.
Oh, apologies.
Okay, don't worry. It's fine, Carol, because if I could quite easily have missed it, but there you go. Yes, thank you. So no questions from members of the public. So item 17, any other urgent items of business? I just wanted to mention a couple of things. Firstly, as Carol's quite nicely introduced me there, that the Primary Care Committee met yesterday. I was going to say mainly to deal with a closure that had been put forward by the Upper Eden practice for their Brough branch surgery, and primarily again due to real severe staffing shortages. And the decision of the committee, and again it was a meeting held in public, the decision of the committee was to close the branch surgery at Brough temporarily for 6 months, with a review after 3 to the committee to see where we were up to, and really basically to explore every single avenue that we possibly could to see if it was feasible for a service to be at Brough branch surgery. So Ed and the team are aware of that. Obviously the surgery aware of that, and we did have a couple of members of the public and some very eloquent members of the public actually who spoke very, very well about the need for the location there and the need for access. I might just so people are aware, it's only open literally a couple of days, and if not part of that day, afternoons a week, and there's a GP attends on one day and it's a practice nurse on the other. Okay, and then the other things I'm going to say, obviously Deb Lee, she did say to us she wasn't able to make today because of COVID, and actually that means it's the last meeting, so she just wanted to pass on her thanks to basically everybody on the governing body for the support that she's received as a governing body member, and also to wish everybody the best of luck, because she won't be here for the next meeting because she's booked. Her and her husband are celebrating a very significant birthday, and they're going across and having a lovely holiday somewhere. So of course she didn't think she was going to be doing this job when she first booked the holiday, because obviously we were going to be finishing on the 1st of April, and so she sends everything and thanks to everybody in relation to that. The other one I wanted to mention, and I've checked it with Julie, and even though I don't think she's managed to get back from her meeting with the MP, her and Ed, the other one is that I think we're all aware, but I just wanted to note that obviously Julie will be leaving us as well sometime in June to take on a fantastic job as the chief executive at Eden Valley Hospice, and she'll be absolutely fabulous in that. A big miss to us, I know, but at the same time a massive coup for them. So that was all I wanted to mention and put on thanks for that. I think Julie will be at the next meeting, but I just wanted to make sure I noted that down during the course of that. Denise, I see you've got your hand up, so please carry on.
Yeah, can I, like Deb, pass on my thanks to everyone on the governing body, and I shall miss you all madly too. It'll be my last meeting because I'm not going quite as far as Deb to the Galapagos, but I will be in the Outer Hebrides when it's the next meeting. Again, sorry, it was booked when we thought we didn't have a job after April, but thank you to all the support. It's been a wonderful few years, and you all worked so incredibly hard in difficult circumstances, so my commendation and applause goes to all of you, but thank you for supporting me in the role.
Sorry about me forgetting that, Denise. My apologies.
Okay.
Apologies. Yeah. Okay. I think that's it. We've got the date of the next meeting, which we've alluded to already, is Thursday, the 16th of June. It will be on Microsoft Teams as well. I did toy with the idea of trying to do a meeting in public and in a venue. It was just proving too difficult at the time, and I thought, look, I don't want to do everything in a public place when we can try and get this done on this line of business and get people at the meeting if that's what they want to do. So we're going to close the meeting there. We do have a separate link for the part 2. I make it just 3 minutes to 3. I'm going to propose that could we start at say 10 past 3, and just for it shouldn't be too long, the meeting. And if I carry on talking, I'll just be closing down your times for a break. It's mainly minutes, but what I wanted to do was, there is something about some REMCON minutes which will affect certain people, and what I'm going to do is, after item 5, which is just finishing off all those minutes,